Hey guys, so Ontario is banning a bunch of supervised drug consumption sites. There's been a lot of talk about these sites in the media, a lot of politics around this, a lot of discussion. What are these sites and what do they do? So the concept here is harm reduction. When people use drugs, we know they use. Can we make it safer for them to use? And so the idea is to provide them with a physical location where they can go with their own supply, they can inject under the supervision of trained personnel. They can test their drugs, see if they're, for example, laced with fentanyl, so that they have a safer drug supply. They can use clean needles provided to them at that site so they don't spread infectious diseases like Hep C and HIV. And if they do overdose at the site, the trained professional is there to inject them with Narcan and save them from that overdose. At the same time, what's really important to understand, particularly because people sometimes associate these sites as a way to promote drugs or normalize drugs, what's happening at those sites is that folks who use are being plugged into the social network. They're being plugged into addictions counselors, social workers, etc., who can help them to ultimately quit. From the scientific point of view, many studies from Canada and from around the world have shown that these sites work. They save lives, they reduce overdose deaths, they reduce actual public usage of drugs and paraphernalia, drug paraphernalia in those neighborhoods where those supervised sites are. They actually improve access to social services and they reduce overall drug use over time. And at the same time, they reduce those infectious diseases spread by shared needles. The reality is that it is really traumatizing for members of the public and particularly for kids to be exposed to drug use and with some of the violence that sometimes comes with drug use. But people forget that, in fact, the locations for these supervised injection sites were selected on the basis of where people are using. People use, those people exist, and removing the sites will not displace those people. They will continue to use, probably in a more public way, and probably we will see more paraphernalia, drug paraphernalia in public spaces, and of course more people will die of overdoses. Our healthcare system will see more burden because right now these sites are treating overdoses, thousands of overdoses a year that will now end up in our emergency rooms and our hospitals. So there's no easy solution to this problem, but some of the things that people think will get better by closing these supervised injection sites will actually get worse.